Dancing is a wonderful field which involves the graceful movement of the dancer. I'm sure that you all have seen the Nutcracker Suite or Swan Lake. The dancer seems to dance effortlessly, though I tell you that this disguise of emotion is only part of their pain. The shoes that they dance on are a legacy of agony and suffering. Dancing on point is a dangerous endeavor that causes damaging foot health and medical problems for dancers. You might ask, what is dancing on point? It's a type of dance form specific to ballet. The website, The Dancer's Notebook, All About Point article, best describes these shoes used. Point shoes are ballet slippers with a hardened, reinforced toe that enables the dancer to perform or dance on the toes. This balance of the full body's weight on such a small area is stressful on the foot. The website wisegeek.com, I found an interesting article that discussed such a concern. It said that, in truth, ballet risks a number of injuries to the lower half of the body. About 60% of ballet injuries affect the legs, hips, ankles, or feet. Of these, about half of all these injuries are specifically related to the feet and ankles, with dancing on point being the major cause of injury. It also said that some minor medical problems that occur regularly with on-point dancing are calluses, bunions, and blisters. More significant problems can include bone spurs and bone degeneration. Not all dancers do well on point, no matter how much they would like to. Actually, the biggest risk in dancing on point is ankle sprain. This is the most common ballet injury, and repeated sprains can end a dancing career of any type. In turn, this brings me to my first point. As you can see, the dancer here on this screen is dancing on her toes. And you see how fully extended her feet are. And the picture next to it, you see a shot of a dancer's feet and her ballet shoes. Usually these shoes don't last more than just a couple of performances before they are just rags and tags. Dancing on point causes damaging foot health. There are a wide range of foot health problems I could list, but I will cover only a few. They are foot plate damage, bunions, arthritis, rheumatoid arthritis, and ankle injuries, which I will only cover one. Foot plate damage mostly happens to young dancers as they try to progress into dancing on point before the recommended age. It says on the website About Sports Medicine, which is reviewed by the Medical Review Board, that the growth plate, the phelus, is the area of developing tissue near the end of the long bones in children. Each long bone has at least one growth plate at each end. This delicate tissue can be damaged if heavy physical exertion is not monitored. The routines that ballerinas do every day can be up to 4 to 5 hours of daily practice for floor routines. This repetitive pressure can affect the direction or growth of the bones in the foot, especially since they are placed in such a rigid area. This seems to be a very similar problem that has been prominent in most athletic, field-based youth sports as well. These are the 5 different types of foot plate damage, as it has various forms of treatment, with the last, which is type 5, being the most serious, which can be most life-affecting, with possible later treatments to correct the damage. Secondly is the effect of bunions. This debilitating disease, in its most advanced form, misshapes the foot to the degree that it can be very painful. As you can see this foot here, there's a bunion that seems to be forming on each side of the foot. And it shows here in the diagram how the phalanges are directed in different ways by the bunions taking place there. The website Northeast Foot and Ankle Specialist says that bunions are misaligned big toe joints that can become swollen and tender, causing the first joint of the big toe to slant inward and the second joint to angle toward the other toes. Bunions tend to be hereditary, but can be aggravated by shoes that are too narrow in the forefoot and toe. When we take a look at the on-point shoe, you can see that it is very narrow, as you can see. The shoe's there. You can see that it is very narrow, and since the box of the shoe is stiff and hard, it bunches the toes into a small area, making this condition a possible fact. This mentioned on the site, Joint Pain Expert Net, that one of the main factors of bunions is the use of footwear with a small and constricting toe box. This seems plausible that this is one of the problems that is exacerbated by these shoes. This leads me to my second point. Dancing on point causes medical problems for dancers. There are quite a few problems that the continuous work on the floor does to the dancer. Many dance halls are not conducive to the dancer's feet, which can cause other problems than just damage to the foot. These medical problems are arthritis and ankle injuries. Arthritis means joint inflammation, and it is used to describe more than 100 different diseases and conditions that affect the joints, the tissues that surround the joints, and other connective tissue. This picture here is a diagram of the ankle and where this condition can happen. With the continuous practice upon hard floors not suitable for the feet, the dancers can add impact upon impact to their joints as they dance. In fact, I found on the website, theperfectpoint.com, that Dr. Lisa Hansen, who is a physical therapist, said it looks so beautiful, but is physically brutal. She says that even though the ballerina's flexibility is off the charts, it is their downfall when they get much older. Another type of arthritis is rheumatoid arthritis. I remember a few years in the past about reading about this disease affecting ballerinas. This disease is a chronic inflammatory disorder. It primarily attacks the synovial joints, the most common points found in humans, which are their joints, which produces an inflammatory response to the soft tissue that lines the non-cartilaginous surfaces within joints and cavities. This typically affects small joints found in your feet and hands in a symmetrical pattern. Both sides of the body are equally affected. I have a picture of this disease to give you an idea of how debilitating it is. See here where the hand to the left is the one that is normal, and the one to the right is the one that's affected by rheumatoid arthritis. It curls the hands to where they will not be very useful later on. And lastly, ankle injuries are, as I mentioned before, one of the biggest risks, which ultimately includes ankle sprains. It is mentioned in an article on the BBC network about ballet and its effects on the ankle bones. Dr. Salonen said ankle problems are one of the leading contributing factors in Indian dancers' career. A third half of the season, these dancers live in chronic ankle pain. Take, for example, this picture of an ankle sprain. By the continuous pressure to perform either for practice or for performances, injury to the ankle can be a very prominent factor. Most doctors I read mentioned that there should be rest between performances to facilitate the health of the ankle. The dangers are irrefutable. The price is the career of a dancer. The end result is a painful existence for the dancer. What a sad thought indeed. All this sacrifice is unnecessary and pointless. Most ballerinas are pushed to do their best. In fact, they look forward to being able to finally do on point. Dancing on point is definitely a dangerous endeavor for dancers and their feet. Thank you for listening to my presentation. I have other informational references that are on the end of my PowerPoint presentation. You can take a look at it. Some of them are YouTube informational in my citations.